ActionSA in Mpumalanga has written to Premier Refilwe Mtsweni-Tsipane about various issues affecting the eMalahleni Thuthuzela Care Centre. The party raises concerns about the centre's standard for a 24-hour operational model as well as patient care at night. But to help us unpack the concerns is Mpumalanga ActionSA chairperson Thoko Mashiane. Mashiane, thank you so much for joining us and for your time this evening. Now, since 2006, 51 Thuthuzela Care Centres have been established across South Africa as a critical part of the anti-rape strategy and to reduce secondary victimization. Now, you've penned a letter to the Premier of Mpumalanga citing a number of concerns, but mainly that the centre does not meet national standards that are set for a 24-hour operational model. How so?
Thank you so much to you, and thank you to the listeners and viewers at home. Yes, it is concerning to us as ActionSA and the community of eMalahleni that the Thuthuzela Centre, which is at the hospital at eMalahleni, the Witbank Hospital, does not open 24 hours as regulated nationally. It only opens from 7 to 4, and there's only one nurse. There's no doctor assigned to those rape victims. And when you come in the evening, you must go to casualty, where you lie waiting for the other emergency. Like if there's a step where a person who's stepped, you have to wait and be exposed. And the secondary victimization occurs in that hospital.
What are some of the other concerns that you've identified at the hospital, or rather at the TCC in particular?
The closing at 4 o'clock, I mean, you can't tell me that people are only raped during the day. Most rapes are happening during the night. So it's either people are going to the casualty where they are exposed to other patients, or they are transported to Mpumalanga Hospital. And according to the regulations, all those things must happen at the center. The FPA who is assigned, who will be in charge of that care center, that Thuthuzela Center, must go to Mpumalanga and go around looking for the person who has been raped. And to us, that is secondary victimization. And these people are no longer becoming victims of the rape of the rapist, but they are also victims of this of government, of the institution which is supposed to protect them, but they are not protected. They don't care about them.
I mean, you make mention that the hospital only operates between 7 to 4. There's only one nurse on duty and no doctor. Has this always been the case? Do we know that some of these concerns are only emanating now, or has this been the standard procedure at the TCC at eMalahleni?
It has been for quite some time, for some years, that it has been happening, that there's no assigned doctor. Even if they come during the day to the center, they have to wait for a doctor who's either in the wards or in the emergency or in his rooms. There's no doctor assigned specifically for them. And that is wrong, because the regulations are saying when they arrive there, they must be treated as soon as they've arrived.
Have you reached out? I mean, you've penned a letter, and this letter obviously asks a number of questions, and in the questions that you're asking, among other things, is when we can expect the appointment of full-time personnel, when will it start operating from a 24-hour basis? Have you gotten any responses from the Premier's office?
Not yet. We're still waiting. Remember, today it's holiday. We sent that letter a day before yesterday, so we're waiting for her to respond to us, because the health issues are provincial competencies. So we need her to respond after consulting with the MEC of Health.
We know that funding has often proven to be a challenge, especially in the health sector, let alone in addressing issues of GBV in our country. And TCCs across the country at some point were very much independent on international donor funding, which has subsequently run dry. How else do you think we can retain the services of counsellors, for instance, in a space where funding is an issue?
You know, South Africa has got a lot of money, but that money is channeled somewhere else instead of being channeled in such issues. This is an issue for the country. And if we can't put budget aside for counseling and for all those things that are needed in those centers, then our country is doomed. You are saying our women must be raped, our children must be raped because we don't have money for them to take care of the care centers.
Mm. And I mean, what would you believe then is the reason that centers such as this, I mean, the idea behind a center such as these TCCs is very much noble and impactful if implemented correctly? What do you think are some of the main hindrances in us not being able to effectively implement ideas such as this that do have a noble outcome?
It's a don't care attitude. There's no political will to help those women, because in most cases, most women who goes to these centers are those women who are poor, who can't afford to go to private hospitals, who can't afford to go to lawyers to ask lawyers to lay their charges against the rapists. So those people are ignored in this country. Nobody's taking care of them. And especially in Mpumalanga, our healthcare system is down the drain. We don't have it at all.
All right. Thank you for joining us and for your inputs this evening. That's Thoko Mashiane, who is the Mpumalanga ActionSA chairperson, speaking to us there about a letter that has been penned to the premier of that province with regards to the eMalahleni Thuthuzela Care Centre.